So this is Maddie.
Hi.
And Maddie's one of our clients who's been coming to the practice for the last few months.
Mm-hmm.
And I think what we did, Maddie, was we confirmed a diagnosis of ADHD and autism
Yeah,
for you.
that's
right.
Yeah.
So we're just curious to know what your experience has been of coming here to the practice and having those diagnoses made. So I suppose the first question was, what made you first come to the practice to see us? What drove you to?
Well, I knew that I always really had autism, but I was really speculating on ADHD because I wasn't entirely sure. But I realized, like, with schoolwork and exams, and it was harder to focus than before in prior years. And I thought it would be good to get a diagnosis just to confirm it was not just me, not being able to focus. And it was actually, there's a reason behind it, but...
Yeah. And I know, you've done exceptionally well. So in spite of these difficulties, you've done so well. Maddie's actually got a place to study astrophysics at university. So you've done incredibly well. So I'm just curious to know what your time with us was like together. What was it like going through the assessment process?
Yeah, I thought it was really good because everyone was really nice and explained stuff I didn't understand, or like when I would ask questions during the exam process with they were really helpful, and everyone was just nice. I liked the experience here. It didn't feel like I was being isolated or anything. I felt like I was just getting someone to help me.
That's really good to hear. And do you feel that we were able to communicate with you okay and explain things the way you... And by the time you'd had your diagnoses, do you feel that you fully understood what was going on for you?
Yeah.
Yeah? And were there any sort of outstanding sort of issues that you still feel you need to discuss with us that we haven't quite covered?
I think you covered everything that I was having issues with or was confused about during speaking to you with the appointments.
Yeah, and I remember your face when we confirmed for you that there was autism and ADHD.
Yeah.
You just seemed so relieved. And maybe did it feel in a way that it explained who you were, a little bit about who you were?
Yeah.
Yeah,
just explain a lot of stuff that I always knew was different compared to other people, but I didn't know if it was because of having autism and ADHD, or if it was just because just different traits. So
yeah. And so you've gone through that process and we've started some medication now and you understand the autism a bit better. How do you feel about your future? How does this, perhaps, what's different in the way you see your future now?
I feel like my future now is I'm like more hopeful about it now, especially with the ADHD diagnosis, because it was quite challenging to do like revision and things. But with the diagnosis, it feels more like there's ways to help it and to help with the future and to just know how I'm going to react to things, prepare me for future exams and careers as well.
And I'm just curious to know how you're going with the medication too, because we did decide to start some medication.
Yeah.
How's that going?
It's not working that well. I feel like maybe like tiny difference.
Okay, tiny difference.
But it's not enough difference to make me focus.
We can think about that.
Yeah.
Is there anything else that you want to say about your experience at the Edinburgh Practice?
Just that the whole atmosphere of coming here was really friendly, and just literally everyone, even the reception people and just people walking by, they were just really nice.
So Maddie, based on your experience, what advice would you give to any other young person that you knew who may have been in a similar situation to you?
I would be happy myself to speak to them about it, or to find someone. They should try and find someone who's had similar experiences or they know has a diagnosis. It was very helpful to speak with people like you. And it's very good to do research as well, especially if you're thinking maybe I have this. You should definitely do further research online. It's very rewarding. It does help you understand things more. And obviously it's not everyone can get a diagnosis, or everyone's symptoms are different as well, so it's harder to place them. You can't like standard, but it's always great to check if you'd be legible, that's a word, for a diagnosis. And I just think it's really rewarding knowing that you have the things that you thought you had, but you weren't sure you had them. So I see getting a diagnosis is definitely a good way to go about it. And here's obviously a very good place to get it done. It's very nice here. Warm atmosphere.
It's really good to hear, Maddie, and I'm so glad that you've had a positive experience with coming here, and it's really helped empower you to understand yourself better and know how you move forward with those difficulties and your wonderful strengths.